Doctor, you were talking about abdominal perineal resection? Yes, I was. And what is an abdominal perineal resection? It is a combined laparotomy and perineal operation for partial or complete removal of the colon and rectum. Doctor, that is not the same as an appendectomy. Of course not. An appendectomy is the removal of the appendix. Doctor, what is a cecectomy? A cecectomy is the excision of the cecum. And a cerostomy? A cerostomy or cecostomy is an external fistulization of the cecum for intestinal obstruction. Doctor, what about colon resection? Well, that is similar to end-to-end anastomosis. It is an excision of the involved colon with or without adjacent lymph glands joining segments of the colon. Doctor, you mentioned a colostomy. Yes, in my report. What is that? That is a formation of an abdominal anus by bringing a loop of the colon to the surface of the abdomen. And an excision, doctor, of the pilonidal cyst? That is a removal of such cyst. And an exteriorization of the pilonidal cyst is what? Well, that is marsupializing the pilonidal cyst. It is laying open the cyst cavity and all its channels. Doctor, what about a diverticulectomy? A diverticulectomy is the removal of the diverticulum, including the resection of the involved bowel. And hemorrhoidectomy? Hemorrhoidectomy is the removal of the hemorrhoids. What is an ileostomy, doctor? An ileostomy is the external fistulization of the ileum, often with total colectomy for ulcerative colitis. And jejuno-ileal bypass? The jejuno-ileal bypass is the creation of a bypass of a considerable portion of the small intestine by joining the proximal jejunum to the terminal ileum and the distal end of the bypassed segment to the cecum. Doctor, that procedure reduces the capacity of absorption? Yes, that procedure reduces the absorptive capacity of the small intestine and induces weight loss. Doctor, are there various techniques that are used to control morbidity? Yes, to control the morbid obesity and hyperlipidemia of the body. And, doctor, the operations for aganglionic megacolon is what? Well, that is more commonly known as Hirschsprung's disease. And is that a modified Duhamel procedure? Yes, a side-to-side anastomosis of the colon and rectum. Doctor, what is a modified Soave procedure? It is an endorectal pull-through of the ganglionated bowel to the anus. And doctor, proctoplasty? Proctoplasty is the plastic repair or construction or reconstruction of the rectum. And reduction of intussusception? Well, intussusception is the normal intestinal continuity restored either by barium enema or, if unsuccessful, by laparotomy. What about the reduction of the volvulus? The volvulus reduction is an untwisting of the lesion by manipulation. And the tube cecostomy? The tube cecostomy is a surgical decompression of the colon by the drainage of the cecum. What is a borborygmus? Borborygmus is rumbling or splashing sound of the bowels. And colic, that is a spasm of any tubular, hollow organ associated with pain. Diarrhea, frequency of bowel action. Fecalith, a fecalith is a fecal concretion. Melena is a black stool, also black vomit due to blood. Obstipation is extreme constipation, often due to obstruction. Finally, doctor, what is steatorrhea? Steatorrhea is increased fat content in feces, as in malabsorption syndrome or in pancreatitis.